She was 82, sharp as ever, living independently, managing her own finances, finishing the crossword every morning. She'd come in for a routine hip replacement, a planned surgery, a good hospital, an excellent surgeon. Her family wasn't worried. The operation went perfectly. By Wednesday, her daughter walked into the hospital room and did not recognize the woman in the bed. Margaret was confused. She didn't know what day it was or quite where she was. She thought it was 1985. She was tugging at her foreline. At one point she became frightened and agitated, convinced the nurses were trying to harm her. That night she didn't sleep. She called out for people who weren't there. By Thursday she was drowsy and withdrawn, barely speaking, staring at the ceiling. Her daughter was terrified. She thought in the space of 3 days her mother had developed dementia. She thought she had lost the woman who had walked in on Monday. A nurse pulled her aside and said the word that changed everything. Delirium. Not dementia. Delirium. A sudden, acute, and, critically, usually reversible state of confusion, triggered by the hospitalization itself. And here is the part that haunted Margaret's daughter afterward. Much of it could have been prevented if the family had known what to watch for, if they had known what to ask for, if they had known the simple things that protect an older brain in a hospital environment. I'm telling you Margaret's story today because hospital delirium is one of the most common, most frightening, and most misunderstood complications of hospitalization in older adults, and almost no family is warned about it before it happens. It affects a huge proportion of older adults who are hospitalized, and an even higher proportion of those in intensive care. It is often mistaken for sudden dementia, and it carries serious, lasting consequences when it isn't recognized and managed. Today I'm going to show you exactly what hospital delirium is, why it happens, how to tell it apart from dementia, what you can do to help prevent it, and how to advocate for your parent if it occurs. Because the single most important message of this video is this: delirium is common. It is often preventable, and an informed family member at the bedside is one of the most powerful protections an older adult can have. Before we go further, if you have an aging parent who might face a hospital stay, planned or unplanned, this is information you need before that day comes, not during it. Share this video with the family members who would be at that bedside. And if you haven't subscribed to this channel yet, do it now. Every week one publish content exactly like this, clinical, honest, and built for families navigating the care of an aging parent. Subscribe so you don't miss what's coming. Let me start by telling you exactly what delirium is, because understanding it is the foundation for everything else. Delirium is a sudden change in mental function, a state of acute confusion that develops over hours or days, not months or years. That speed is the single most important clue. Dementia develops slowly, gradually, over a long period. Delirium comes on fast. If your parent was mentally clear last week and is profoundly confused today, that is far more likely to be delirium than dementia. The brain hasn't permanently changed. It has been acutely disrupted, and disruption can usually be reversed once the cause is found. There's something else crucial to understand. Delirium has more than one face, and one of them is very easy to miss. The kind most people imagine is hyperactive delirium, the agitated, restless, frightened patient pulling at lines, trying to climb out of bed, sometimes hallucinating. That version gets noticed because it's disruptive. But there's also hypoactive delirium, quiet, withdrawn, drowsy, sleepy, not engaging. This version is actually more common in older adults, and it's the more dangerous one precisely because it gets missed. A quiet, sleepy patient doesn't set off alarms. Staff may assume the person is simply tired or resting or a bit out of it, but that quiet withdrawal can be delirium just as much as the agitation, and it carries the same serious risks. Margaret had both, agitated and frightened one day, withdrawn and barely responsive the next. That fluctuation, that coming and going, is itself a hallmark of delirium. Now let me explain why this happens, because once you understand the causes, you understand both how to prevent it and how to help reverse it. The aging brain has less reserve. It's more vulnerable to disruption than a younger brain, which means a whole range of stressors that a younger person would shrug off can tip an older brain into delirium. Hospitalization stacks those stressors on top of each other all at once. Consider what a hospital actually does to an older person. It removes them from every familiar reference point, their home, their routine, their own bed. It disrupts sleep relentlessly. Lights on at all hours, vital signs checked through the night, alarms beeping, no day-night rhythm. It introduces new medications, often several, some of which directly affect the brain, sedatives, certain pain medications, and others. It brings pain, infection, and the physical stress of illness or surgery. It causes dehydration. It produces electrolyte imbalances. It immobilizes people in bed. It takes away their glasses and their hearing aids, cutting them off from the sensory information that keeps them oriented. And it often involves anesthesia, which the older brain takes longer to clear. Any one of these can contribute. Stacked together, as they are in nearly every hospitalization, they create the perfect conditions for an older brain to lose its footing. This is why delirium is so common, and also why it's often preventable, because many of these triggers can be reduced. The most common specific causes worth knowing are infections, especially urinary tract and respiratory infections, which, as I have covered before, often present in older adults with confusion rather than typical symptoms. Medications, especially newly started ones, and sedatives, dehydration and electrolyte imbalances, uncontrolled pain, and, importantly, sometimes the pain medications used to treat it, lack of sleep, constipation and urinary retention, and withdrawal from alcohol or certain medications the person normally takes. The reason this matters to you: many of these are findable and fixable, which is exactly why an engaged family member who can provide information and raise concerns is so valuable. If you're finding this valuable, and I hope you are, take 1 second right now and hit the like button. It genuinely helps this content reach other families before they face a hospitalization unprepared. Like and keep watching. Now let me give you the most empowering part of this video, what you can actually do to help prevent delirium, because families have far more influence here than they realize. Your presence itself is protective. This is not sentimental, it is clinical. A familiar face, a familiar voice, someone who can orient your parent and reassure them measurably reduces delirium risk. If your parent is hospitalized, having family present as much as possible, especially during the vulnerable evening and night hours when delirium often worsens, is one of the most effective interventions that exists. This phenomenon of evening worsening even has a name, sundowning, and it's a key window when your presence matters most. Here are the concrete, practical things you can do at the bedside. Bring their glasses and their hearing aids, and make sure they're actually being used. Sensory deprivation is a major, easily fixable trigger. Bring familiar objects from home, a photograph, a blanket, a clock they can see. Repeatedly and gently orient them. Remind them where they are, what day it is, why they're there, who you are. Keep a window shade open during the day and lights low at night to help restore the day-night rhythm the hospital destroys. Encourage them to drink fluids if they're allowed. Encourage movement, getting out of bed and walking even a little as soon as it's safe, because immobility worsens everything. And advocate fiercely for their sleep. Ask the staff whether overnight vital sign checks and non-urgent interventions can be clustered or minimized so your parent can actually rest. And then there's advocacy around medications and causes. You can respectfully but persistently ask the team questions that matter. Could any of the new medications be contributing to this confusion? Has my parent been checked for a urinary tract infection? Are they getting enough fluids? Could pain or constipation or lack of sleep be playing a role? You are not being difficult by asking these. You are doing exactly what a good advocate does. Some sedative medications in particular, a class often flagged as risky for older adults, can cause or worsen delirium, and a family member asking whether a safer alternative exists can genuinely change the course of a hospitalization. There's one more thing only you can provide, a baseline. The hospital staff have never met your parent before. They don't know that on Monday she was doing the crossword and managing her own finances. You do. Telling the team clearly, this is not how my mother normally is. Last week she was completely sharp. This is a sudden change, is one of the most important things you can say, because it helps the staff recognize delirium instead of mistaking acute confusion for the patient's normal state or for pre-existing dementia. That single piece of information can trigger the right evaluation. This is the moment in the video where I want to ask you something directly. If this video is giving you something you didn't know, something you'd want at the bedside if your parent were hospitalized tomorrow, share it with the family members who would be there with you. Because delirium prevention is a team effort, and a family that knows what to watch for and what to ask is dramatically more powerful than one caught off guard. Share it. Leave a comment below telling me about your own experience if you've been through this. And subscribe if you haven't yet. It's the best way to keep this kind of guidance coming. Now, what if delirium has already happened? What do you do then? First, understand that it is usually reversible, but recovery takes time. Once the underlying causes are identified and treated, the infection cleared, the problematic medication stopped, the dehydration corrected, the sleep restored, delirium typically improves. But it doesn't always resolve the moment the cause is fixed. It can take days and sometimes weeks for an older brain to fully return to baseline. Knowing this helps you hold on to hope and stay patient through a frightening process. The confusion you're seeing is, in most cases, not your parents' new permanent reality. Second, keep doing all the supportive things, the orientation, the presence, the glasses and hearing aids, the calm reassurance. These help recovery just as they help prevention. Third, and I want to be honest with you here, delirium should be taken seriously, even though it's usually reversible. It is associated with longer hospital stays, higher risk of complications, and in some cases incomplete recovery, particularly in those who already had some cognitive vulnerability. A small but real number of older adults don't fully return to their prior baseline. This is precisely why prevention and early recognition matter so much, and why your role is so important. And fourth, plan for the period after discharge. Recovery often continues at home. Your parent may remain somewhat confused, weak, or not quite themselves for a while after leaving the hospital. They'll need a calm environment, good sleep, hydration, gentle reorientation, and patience. The transition home is a vulnerable window, and knowing that in advance lets you prepare for it, rather than panic in the middle of it. Here is what your family can do in practical terms. Before any planned hospitalization, have a conversation with the medical team about delirium risk in advance. Ask what the hospital does to prevent it. Arrange family presence in shifts so your parent isn't alone, especially at night. Pack the glasses, the hearing aids, the familiar objects, and a written summary of your parent's normal baseline and current medications. During hospitalization, be present, orient gently and often, protect sleep, ensure glasses and hearing aids are used, encourage fluids and safe movement, and watch closely for any sudden change in mental state, including the quiet, withdrawn kind. If you see it, speak up immediately and clearly. This is a sudden change from how my parent normally is. Ask the questions about infection, medications, hydration, pain, and sleep. After discharge, expect that recovery may continue. Provide a calm and familiar environment, maintain hydration and good sleep, reorient patiently, and follow up with the doctor about any lingering confusion. And throughout, hold on to the central truth. What looks like a sudden, devastating descent into dementia is, in most cases, delirium, frightening, yes, but usually temporary, often preventable, and powerfully influenced by an informed family member who knows what to do. Here's what I want you to carry with you from today. Margaret recovered. It took about 2 weeks, longer than her daughter expected, long enough to be frightening, but the infection that had been quietly driving much of it was treated. A sedative she'd been given was stopped. Her family stayed at her bedside in shifts, brought her glasses and her own pillow, kept reminding her where she was and that she was safe. Slowly, the mother her daughter knew came back. She went home. She did the crossword again. Her daughter said something afterward that I think about often. She said, "I thought I had lost her overnight." And the most terrifying part was that I had no idea this was even a thing that could happen. If I'd known, if someone had just told me, I would have done everything differently from the very first day. That's why I made this video, so that you are not caught off guard the way she was, so that if the day comes when your parent is in a hospital bed, you walk in already knowing what to watch for, what to ask, and what to do. What to do? That knowledge is one of the most protective things you can bring to their bedside. You have it now. If this video gave you something real, something you're going to remember, or share with someone or carry into a hospital room one day, please take a moment to like it. Share it with the people who share your parents' care, because every one of them should know this before they need it. And leave a comment below telling me about your own experience, what helped or what you wish you'd known sooner. I read every single one. And if you haven't subscribed to this channel yet, please subscribe. This is where I publish honest, clinical, practical guidance for families trying to do right by the people they love every single week. Thank you for being here and for caring enough to watch all the way to the end. That attention is exactly what makes the difference. I'll see you soon.